Good day, everyone. I am Ana Blanca F. Montoro, a BS Ed Science 3A student, and for today's video, we will be discussing about the multifactorial disorders and genetic counseling and testing. First and foremost, let us define the following terms. First, the disorder. A disorder could be defined as a set of problems which result in causing significant difficulty, distress, impairment, and or suffering in a person's daily life. The Oxford English Dictionary defines a disorder as an illness that disrupts normal physical or mental function. Second is the polygens. A polygenic trait is one whose phenotype is influenced by more than one gene. Traits that display a continuous distribution, such as height or skin color, are polygenic. The inheritance of polygenic traits does not show the phenotypic rhesus characteristic of Mendelian inheritance, though each of the genes contributing to the trait is inherited as described by Gregor Mendel. Many polygenic traits are also influenced by the environment and are called multifactorial. Third is the spina bifida. It is a condition that affects the spine and is usually apparent at birth. Lastly is the anencephaly. It is a serious birth defect in which a baby is born without parts of the brain and skull. It is a type of neural tube defect. Now let us define what is a multifactorial disorder. Multifactorial disorders are caused by multiple genetic and environmental factors. The study of multifactorial disease involves several steps, including determination of disease heritability, segregation analysis to determine the genetic model, linkage or association mapping to identify genetic loci underlying the disease, fine mapping to determine the causal variants, and replication and functional analysis to confirm the initial findings. Early research in multifactorial inheritance. The first scientist to study multifactorial inheritance was Francis Galton, Charles Darwin's cousin. Like his contemporary Gregor Mendel, Galton studied the inheritance of traits. However, unlike Mendel, Galton observed what he called blending characters. Blending is now known as continuous variation, describing a gradation in expression in which phenotypes such as human height do not fall into distinct categories. Multifactorial disorders is divided into two factors. First is the congenital malformations and second is the acquired diseases of childhood and adult life. An example of a congenital malformation is a cleft lip and cleft palate. These are the openings or splits in the upper lip and the roof of the mouth, or both. Cleft lip and cleft palate result when facial structures that are developing in an unborn baby don't close completely. Cleft lip and palate are among the most common birth defects. They most commonly occur as isolated birth defects, but are also associated with many inherited genetic conditions or syndromes. Second is a congenital heart disease. It is a general term for a range of birth defects that affect the normal way the heart works. The term congenital means the condition is present from birth. Congenital heart disease is also one of the most common types of birth defect, affecting almost 1 in 100 babies born in the UK. Also, about 80% of congenital heart disease is multifactorial and arises through various combinations of genetic and environmental contributors. About 20% of cases can be attributed to chromosal anomalies, Mendelian syndromes, non-syndromal single-gene disorders, or teratogens. Down syndrome and velocardiofacial syndrome are the most commonly seen syndromes in patients. Third is a neural tube defects. These are the typical examples of a multifactorial congenital malformation. Neural tube defects are birth defects of the brain, spine, or spinal cord. They happen in the first month of pregnancy, often before a woman even knows that she is pregnant. The two most common neural tube defects are spina bifida and anencephaly. In spina bifida, the fetal spinal column does not close completely. These congenital disorders result from an interaction between genetic factors, usually a number of inherited genes, and an environmental factor, probably viral, dietary, toxic, or radiation. Multifactorial defects such as neural tube defects occur in both males and females. Lastly, the congenital dislocation of hip. Developmental dysplasia of the hip is a condition where the ball and socket joint of the hip does not properly form in babies and young children. The hip joint attaches the thigh bone or femur to the pelvis. Now let's go to the second factor of multifactorial disorders, which is the acquired diseases of childhood and adult life. First is the asthma. Asthma certainly runs in the families. A person with 1% with asthma has around of 25% chance of being affected compared to a 5% chance for a person with no family history of the condition. However, genomics does not account for every case. Interestingly, early onset asthma is more strongly associated with the family history of the condition than adult onset asthma, indicating that the gene variants with the causative effect are likely to influence the onset asthma in children, whereas environmental factors may be more influential in life. There is also a difference in the patterns of genes associated with allergic asthma and non-allergic asthma, which is rare in younger people. Second is the diabetes mellitus. It is a group of metabolic diseases characterized by high blood sugar levels that result from defects in insulin secretion or its action, or both. Diabetes mellitus, commonly referred as diabetes, was identified as a disease associated with sweet urine. There are two main forms of diabetes mellitus. First is the type 1. It is the rarer juvenile onset insulin-dependent form which affects 0.4% of the population and shows a high incidence of potentially serious renal, retinal, and vascular complications. Second is a type 2. It is more common, later onset, non-insulin dependent form that affects up to 10% of the population. Third example of acquired diseases of childhood and adult life is the epilepsy. It is a heterogeneous group of multifactorial diseases, the vast majority determined by interactions between many genes and environmental factors. However, there are rare epilepsy syndromes that can be caused by a single gene mutation and are inherited according to classical Mendelian genetic principles. Epilepsy can arise directly or indirectly as a symptom of another condition from genetic disorders related to a specific gene. A combination of genetics and environmental factors, mutations in the DNA mitochondria, missing or mutated chromosomes, or changes in the activity of genes. Lastly is the manic depression. This gene-environment interaction is well illustrated by the influence of childhood trauma on the clinical expression of the disease in terms of age of onset, comorbidity, and suicide. The complexity and heterogeneity of bipolar disorder require the identification of homogeneous subgroups with the use of biomarkers that could help reduce the etiological heterogeneity and better target the therapeutic options. Bipolar disorder often runs in families, and research suggests that this is mostly explained by heredity. People with certain genes are more likely to develop bipolar disorder than others. Many genes are involved, and no one gene can cause a disorder. But genes are not the only factor. Some studies of identical twins have found out that even when one twin develops bipolar disorder, the other twin may not. Although people with a parent or sibling with bipolar disorder are more likely to develop the disorder themselves, more people with a family history of bipolar disorder will not develop the illness. Now let us go to the new topic, which is the genetic counseling. First, let us define what is a genetic counseling. Genetic counseling gives you information about how genetic conditions might affect you or your family. The genetic counselor or other healthcare professional will collect your personal and family health history. They can use this information to determine how likely it is that you or your family member has a genetic condition. Based on this information, the genetic counselor can help you decide whether a genetic test might be right for you or your relative. We should also consider the reasons for genetic counseling. Based on your personal and family health history, your doctor can refer you for genetic counseling. There are different stages in your life when you might be referred for genetic counseling. First is the planning for pregnancy. This involves the genetic conditions that run in your family or your partner's family. History of infertility, multiple miscarriages or stillbirth, previous pregnancy or child affected by a birth defect or genetic condition. Second is during pregnancy. This involves the history of infertility, multiple miscarriages or stillbirth, previous pregnancy or child affected by a birth defect or genetic condition, abnormal test results such as blood test, ultrasound, chorionic villus sampling or CVS, or amniocentesis. Also, maternal infections such as cytomegalovirus or CMV and other exposure such as medicines, drugs, chemicals, and X-rays. Lastly is a genetic screening that is recommended for all pregnant women, which includes cystic fibrosis external icon, sickle cell disease, and any conditions that run in your family or your partner's family. Third reason for genetic counseling is caring for children. This includes abnormal newborn screening results, birth defects, intellectual disability or developmental disabilities, autism spectrum disorders, and vision or hearing problems. And lastly, managing your health. This includes hereditary breast and ovarian cancer syndrome, Lynch syndrome, familial hypercholesterolemia, muscular dystrophy and other muscle diseases, inherited movement disorders such as Huntington's disease external icon, and inherited blood disorders such as sickle cell disease. And the last topic for today's video is genetic testing. Let us define first what is genetic testing. Genetic testing looks for changes, sometimes called mutations or variants in your DNA. Genetic testing is useful in many areas of medicine and can change the medical care you and your family member receives. Genetic tests are done using a blood or spit sample and results are usually ready in a few weeks. Because we share DNA with our family members, if you are found to have a genetic change, your family members may have the same change. Genetic counseling before and after genetic testing can help make sure that you are the right person in your family to get a genetic test, you're getting the right genetic test, and that you understand your results. Let us now go to the types of genetic tests. There are many different kinds of genetic tests. There is no single genetic test that can detect all genetic conditions. The approach to genetic testing is individualized based on your medical and family history and what condition you're being tested for. First is a single gene testing. These tests look for changes in only one gene. Single gene testing is done when your doctor believes you or your child have symptoms of a specific condition or syndrome. Some examples of this are Duchenne, muscular dystrophy, or sickle cell disease. Single gene testing is also used when there is a known genetic mutation in a family. Second is a panel testing. A panel genetic test looks for changes in many genes in one test. Genetic testing panels are usually grouped in categories based on different kinds of medical concerns. Some examples of genetic panel tests are low muscle tone, short stature, or epilepsy. Panel genetic tests can also be grouped into genes that are all associated with higher risk of developing certain kinds of cancer like breast or colon cancer. Lastly is the large-scale genetic or genomic testing. There are two different kinds of large-scale genetic tests. First is the exome sequencing. Looks at all genes in the DNA or whole exome or just the genes that are related to medical conditions. And second is a genome sequencing. It is the largest genetic test and looks at all of a person's DNA, not just the genes. Exome and genome sequencing are ordered by doctors for people with complex medical histories. Large-scale genomic testing is also used in research to learn more about genetic causes of conditions. Large-scale genetic tests can have findings unrelated to why the test was ordered in the first place. Examples of secondary findings are genes associated with a predisposition to cancer or rare heart conditions when you were looking for a genetic diagnosis to explain a child's developmental disabilities. There are three types of genetic test results. These are the positive, negative, and uncertain. First is a positive. The test found a genetic change known to cause disease. In negative, the test did not find a genetic change known to cause disease. Sometimes a negative result occurs when the wrong test was ordered or there isn't a genetic cause for that person's symptoms. And lastly, uncertain. A variant of a known or uncertain significance means there isn't enough information about that genetic change to determine whether it is benign or normal or pathogenic or disease-causing. And that's it for today's video. I hope you learned something. Thank you!